Welcome to the Deep Dive. We're here to cut through the complexity and get straight to the insights you need. Today, we're plunging into a topic that, well, at some point, touches all of us. How technology is fundamentally transforming patient services. If you've ever had to navigate getting a critical medication, or maybe wrestle with stacks of paperwork, or just try to understand a complex support program, you know it can be a real struggle. So our mission today is to explore a central question. How can we make that entire patient journey smoother, faster, and frankly, much more efficient?
That's right. And to really tackle that, we're focusing on a pretty significant reimagining of what's known as the Patient Services Hub. And we're doing that through something called digital labor. Now, this isn't just about small tweaks or incremental improvements. It's really about leveraging cutting-edge technologies. Think Salesforce, think generative AI, to truly revolutionize how patients access care. The goal is clear. We want to cost-effectively accelerate how quickly a patient can actually start their therapy and critically significantly improve their ability to stick with it. It's about ensuring they get the care they need faster and more consistently.
Okay, let's unpack this then before we jump into the solutions. What's actually broken right now? What are the biggest frustrations people face in the, let's call it the traditional patient service model? Our sources paint a pretty clear picture. Seems like there are challenges for pretty much everyone involved.
They absolutely do, yeah. We can really understand this if we look at what the research calls the voice of the customer. So for patients and their caregivers, the difficulties are, well, they're immense. Just imagine someone already dealing with a serious illness, right? And then they have to navigate these incredibly complex eligibility criteria. We're talking specific rules, like needing to be at or below 300% of the federal poverty level, or being uninsured, or maybe having only government insurance, plus U.S. residency and needing specific program enrollments by a certain date, say 2025. It really is a labyrinth.
Wow, yeah, that sounds incredibly complicated already.
And then you add the sheer volume of documentation required. Think tax returns, W-2s, pay stubs, sometimes even Medicare denial letters. It can just be overwhelming, especially for those who might have low literacy or maybe limited access to technology. And language barriers are another huge hurdle. We see patients getting really confused trying to use self-service portals. There's one common type called PAPE Connect for patient assistance programs, but they can be clunky. And those static FAQs you find online, they just don't offer the real-time, personalized help people desperately need when they're stuck.
So that's the patient and caregiver side. It sounds rough. What about the doctors and other healthcare professionals, the ones trying to help navigate all this?
Right. For providers, it's a really heavy administrative burden. They get bogged down with things like certification delays, problems tracking their patient's progress through the system, and the constant need for reapproval just for refills. It eats up so much time they could be spending on actual patient care.
I can imagine. And the staff within the healthcare organizations themselves.
Yeah, the HCO staff, they're often working with pretty limited digital tools. They end up spending hours on manual follow-ups for benefit verification, that's BV, and prior authorization, or PA. Plus, they often have to juggle multiple different portal logins, which is just incredibly inefficient.
Okay, so patients, providers, HCO staff. What about the actual patient support teams, the people on the front lines in these hubs? What kind of headaches are they dealing with?
Oh, they face significant challenges too. Onboarding a new patient is incredibly complex. You've got to gather all sorts of consents and authorizations. And there are often multiple handoffs internally, and also with external hubs or pharmacies, things can easily fall through the cracks.
So it's not just individual roles, it sounds like the whole system has issues.
Exactly. Beyond those individual pain points, the system itself is inherently flawed in the traditional model. Our sources highlight a really heavy reliance on manual data entry. There's often poor visibility into why applications get rejected, which is incredibly frustrating for everyone. And the approval timelines are notoriously long. We're often talking 2 to 3 weeks, sometimes longer.
2 to 3 weeks, wow.
Yeah. And this problem even extends to annual renewals. Patients might have to start the entire application process from scratch every single year, which, as you can imagine, frequently leads to dangerous lapses in their medication supply.
Yeah.
Think about the anxiety that causes for someone who relies on consistent medication.
So if we pull all that together, it sounds like the traditional patient services hub is just fundamentally bogged down, a lack of real-time support, kind of outdated technology, and just an immense amount of manual work piling up everywhere.
Precisely. The insights from our research really boil down to a few core problems with the traditional hub model. First, customization. It's just too costly and way too time-consuming to tailor workflows for each specific patient program. And every drug, every condition has its own nuances, right? The old systems just can't adapt easily or affordably.
Okay, lack of flexibility. What else?
Second, when you look at omnichannel support and just basic user friendliness, the tech is often antiquated. That leads to big user adoption challenges. Patients and providers today, they expect to use familiar communication channels, SMS, email, maybe even secure messaging, fax sometimes is still needed, but these aren't always supported or integrated well.
Right, people want to communicate how they normally communicate.
Exactly. Third, 24/7 support is largely absent. Most traditional hubs just can't offer round-the-clock help. So you get these frustratingly long call center wait times, especially during peak hours when people are most likely to call. And finally, innovation and data access. These are critical, but often missing. Innovation gets tied to whatever the vendor's roadmap is, which makes it slow. And getting real-time data for crucial things like enrollment status, BV, PA, it's rarely available when it's needed most. This creates this system that's slow, opaque, and incredibly frustrating for everyone involved.
Okay, so given that complex, often really frustrating reality of the current patient journey, I'm definitely eager to hear how this digital labor concept offers a distinctly different path forward. This really sounds like it could be a potential game changer.
It truly is, or at least it has the potential to be. This concept really aims to completely transform how patient services operate day to day. We're talking about moving beyond these slow manual processes towards real-time data exchange and workflows streamlined with generative AI. The ultimate goal here is a dramatic increase in operational efficiency, yes, but also significant cost savings. And crucially, a much faster time to therapy for patients who desperately need their medications.
Can you really bring this to life for us, though? Like, how does a patient's actual experience, or maybe provider's day, fundamentally change with this digital model compared to what they're dealing with now? Give us some concrete examples.
Okay, let's walk through some before and after scenarios. Take intake and engagement, the old way. Manual forms, maybe long calls with call center agents. The digital hub shifts that to seamless omni-channel enrollment, maybe start on a website, finish via text, with generative AI handling a lot of the back-end automation.
Okay, smoother start. What about getting the medication covered?
Right, access and coverage. That moves from those manual phone calls for benefit verification, prior authorization appeals, all that back and forth. Instead, you have electronic BV and PAEBV, EPA, often powered by intelligent workflows in the call center, maybe even predicting and addressing potential issues before they cause a delay.
Proactive, I like that. What about getting the patient started, onboarding?
Yeah, onboarding and initiation. Instead of just maybe outbound calls from hub staff, with patients perhaps unaware if information is missing, the digital model brings automated notifications. Alerts go directly to healthcare providers, the HCPs, and to the patients themselves, prompting them for exactly what's needed. Much clearer, much faster.
And how about keeping patients on track with their treatment? That's always a huge challenge, right? Adherence.
Exactly, that's a critical piece. For patient adherence, the traditional model often relies on direct communication, maybe limited to phone, fax, email. It's reactive. The digital hub introduces things like virtual assist agents, maybe chatbots, or specialized call center AI agents. They can handle routine questions, deflect calls, offer reminders, making support more accessible and proactive. It might even remind patients about their next dose or a follow-up appointment.
Okay, and the data side, analytics.
And finally, yes, analytics and reporting. We move away from just getting static, often delayed offline reports. We move towards real-time, next best actions. Personalized suggestions for patients, for HCPs, for the specialty pharmacies, even for the hub users themselves. All driven by tailored, immediate insights from the data. Imagine the system predicting where a patient might struggle with adherence and suggesting an intervention before it happens.
That really does sound like a complete overhaul. What are the specific digital agents or technologies involved in making this actually happen? It sounds like there are quite a few moving parts that need to work together seamlessly.
There are, yeah, but the key is integration. The core components of a reimagined digital hub include several specialized agents or automated functions. We're talking about things like document triaging agents, which can automatically sort and categorize all those incoming patient documents we mentioned earlier. Saves a huge amount of time. Then there's electronic consent management for streamlined digital approvals, no more chasing paper signatures.
Makes sense.
Missing information agents that automatically flag incomplete data and can even prompt the patient or provider for it directly. Then the EBV and EPA agents for automated benefit verification and prior authorization. These often connect directly with insurance clearinghouses like SureScripts for faster, more accurate results, and income verification agents to automatically help confirm eligibility based on those complex rules.
Okay, so automating a lot of the verification and documentation. What else?
There are also patient adherence agents, like we discussed, designed to help patients stay on track with reminders, education support, and contact center assist agents. These can either support the human agents with information and suggestions in real time, or sometimes directly handle routine inquiries through chat or voice, freeing up the human agents for more complex issues.
And this all runs on what kind of platform?
Right, all of these functionalities are typically built on robust platforms, often things like Salesforce CRM for the core patient relationship management, paired with maybe specialized agent workflow tools, something like Agentforce, and powerful data analytics platforms that centralize all the information for that 360-degree view.
And the payoff. What are the real-world benefits we're seeing for patients and the industry? Because those numbers you alluded to earlier from the sources, they sound incredibly impressive.
They really are. Our sources cite some truly remarkable potential outcomes from implementing these digital hub models. We're looking at potentially a 30% increase in patient enrollment. That means significantly more people accessing the critical treatments they need.
30%, that's huge.
It is, and maybe even more impactful, an 80% reduction in the overall cycle time for therapy initiation. We're cutting weeks down to days, getting patients their life-saving or life-changing medication much, much faster.
80% reduction.
Wow.
What about the operational side? Costs.
Significant improvements there too. A potential 20% reduction in overall operational costs, and a 2x increase in onboarding rates, getting patients through that initial process much more efficiently. Cumulatively, this leads to an overall 30% increase in operational efficiency. That translates directly into improved hub productivity. But most importantly, it means significantly increased patient satisfaction. These aren't just abstract numbers. They represent real patients getting crucial treatments much sooner, and healthcare systems operating with unprecedented efficiency, which hopefully frees up resources for even better care down the line.
So it really is about connecting all the dots for the patient, isn't it? From the very start to staying on therapy, making that whole journey as smooth and supportive as possible.
It's exactly right. This whole concept is often called omnichannel patient orchestration. It really means engaging patients proactively and personally across all the channels they use, whether that's phone, email, fax, yes, still fax, sometimes EHR integration, electronic health record, SMS texting, secure CRM portals, meeting the patient where they are.
And the goals of that orchestration.
The goals are clear. Create truly personalized patient pathways, provide better, more timely patient education, significantly improve treatment adherence, and establish a continuous feedback loop that constantly refines the process based on real data and experience. The benefits really cascade across the entire healthcare system. You get centralized patient management with that comprehensive patient 360 view we talked about. You get a superior customer experience, which matters a lot in healthcare. And you get actionable insights from comprehensive analytics to keep improving.
Okay, this all sounds incredibly promising, almost too good to be true in some ways. I have to imagine there are significant hurdles, real barriers to overcome to move from that entrenched traditional system to this sophisticated digital hub. What are the biggest roadblocks organizations face when they try to make this leap?
You're absolutely right to ask that. The transition isn't without its challenges, definitely not. Our sources identify 3 primary barriers to moving towards this digital labor-centric hub, and each has a sort of perceived cost that makes organizations understandably wary. The biggest concern, cited by about 50% of organizations surveyed in one study, is a higher initial investment.
The upfront cost, yeah.
Exactly. Building a new digital platform, integrating these AI tools, it often requires external partners, specialized expertise, and significant capital expenditure. And proving the return on investment, the ROI, isn't always straightforward, especially if you're trying to justify it for just a single program or brand initially. The challenge often lies in convincing individual drug programs or brands to shoulder that upfront cost for a platform that will ultimately benefit many across the organization.
That makes perfect sense. It's a big ask, a big upfront commitment, especially if the benefit seems spread out. What's the next major hurdle according to the research?
The next one, accounting for about 25% of the expressed concern, is the complexity of navigating multiple parties. The regulatory and compliance landscape in healthcare is frankly daunting. You've got legal departments heavily involved, especially for things like business associate agreements or BAAs.
Right, those are crucial for data privacy.
Absolutely. They define how patient health information is shared and protected between different entities. Then you have procurement teams negotiating contracts with all the service providers. You need close collaboration with internal IT for technology selection, integration, and security, which is paramount. And renegotiating scope and cost with vendors. That requires a specific skill set, too. It's just a complex web of stakeholders, internal and external, who all need to be aligned.
Okay, so cost and complexity of coordination, what's the final piece? Also around 25%. Is that about getting internal buy-in?
Precisely. The third major barrier, also cited by about 25%, is achieving and maintaining leadership support through the finish line. Gaining strong, consistent support from senior leadership from the very beginning all the way through implementation and beyond is absolutely crucial for such a transformative project. Aligning all the different therapeutic areas, cardiology, oncology, immunology, whatever the company focuses on, and the brand leadership within those areas, that can be a significant challenge.
I can imagine different priorities, different budgets.
Exactly. And convincing the commercial leadership, the folks holding the purse strings, on the budget needed for this digital hub migration, that requires a very strong business justification and a really clear, compelling ROI pitch. These aren't easy internal conversations, but they're absolutely essential for getting a project like this off the ground and seeing it through.
So given these pretty significant challenges, cost, complexity, leadership alignment, how does an organization even begin to make this transition? It sounds overwhelming. Is there a kind of crawl, walk, run approach that makes it more manageable than just trying to do one giant leap?
There is, thankfully. Our sources do suggest a phased approach that provides a clearer, more manageable roadmap. It starts with the crawl phase. This is really the foundational stage. Organizations should begin by designing a realistic 1 to 2 year roadmap for their digital hub transition. What are the key steps, the milestones? It's really essential to redesign any new launch program workflows with this digital vision in mind right from the outset. Don't build new programs on the old chassis.
Start fresh where you can.
Exactly. Ensuring proper handling of patient and provider consents, getting those BAAs sorted out early, that's critical foundational work. They should also design a 24/7 contact center solution early on, thinking about both voice and non-voice channels like chat and email. And maybe most crucially in this phase, selecting the right digital technology platform and the right implementation partner. That choice can make or break the whole initiative.
Okay, so getting the strategy, the groundwork, the partnerships in place, what happens once that foundation feels solid in the walk phase?
Right. The walk phase is all about the core implementation. This is where the build really happens. Organizations would implement the core patient CRM, ideally on a modern, flexible platform like Salesforce to track everything. Enrollments, consents, BVPA status, all those patient interactions. They'd set up that modern contact center environment they designed, maybe starting to introduce some AI-enabled agents for handling calls, chats, emails, faxes. Key functions like enrollment, consent management, benefit verification, these should be automated using that agentic AI approach, maybe integrating with clearinghouses like SureScripts for that real-time data feed. And finally, enabling dashboards and reports is critical here. You need to start seeing the data and gaining those real-time insights to know if it's working.
So you're building the engine, getting it running, and then once you're walking, you can really start to run. What does that optimization and expansion look like?
Exactly. The run phase is where you really leverage the foundation you've built. It focuses on optimization and expansion. This is where organizations build out those more robust patient education and adherence solutions, fully enabling that patient orchestration framework we talked about. They'd connect their patient support programs with external resources like patient community portals and advocacy groups, creating a much more holistic support system around the patient.
Integrating more broadly.
Yes. Establishing a dedicated portal for healthcare providers, HCPs, is also key in this phase. A place where they can easily see their patients' journeys, track progress, and facilitate smooth two-way communication between patients, specialty pharmacies, the HCPs themselves, and the hub. And finally, opening up access for specialty pharmacies to relevant patient journey data. This helps them anticipate needs and ensure timely dispensing of medications. It's really about maximizing the connectivity and enabling proactive engagement across that entire patient ecosystem.
This has been a truly illuminating deep dive today. We've really journeyed through the transformation of patient services. It's become so clear that while the challenges, the hurdles are definitely real, the potential of digital labor, of AI, of these integrated platforms, it's immense. The potential to create a more seamless, much more accessible, and ultimately just a more effective healthcare journey for patients is huge. We've seen how streamlining these tangled processes, providing that real-time support, and leveraging AI can really significantly improve outcomes for patients, and at the same time, ease some of the burdens on providers and everyone else working so hard within the system.
Indeed. It really has been fascinating to map out. And it brings up, I think, an important question as we wrap up. As these digital hubs become more sophisticated and more prevalent, how might the very nature of the patient-provider relationship evolve? Could we move beyond just focusing on access to medication towards something more like a truly personalized, continuously supported health experience? What stands out to you in this shift? And thinking ahead, what further changes might we see in how patients engage with their own healthcare as this technology becomes even more deeply ingrained in the fabric of how care is delivered? Food for thought.